Hello and good afternoon, or whatever time that you're watching this. My name is Maisie Moorhead. Today I will be presenting on Yersinia pestis. Yersinia pestis is a zoonotic bacterial pathogen. It is most well known for causing plague. It is endemic here in the western US, and there are several parts across the globe where it lives. It's a gram-negative, non-motile, single or short-chained bacillus. You can see that its gram stain is here on the right. This little infographic comes from the World Health Organization. So it is caused by a bacteria found in small mammals, and their fleas carry that bacteria, bite humans, and infect us. People who are infected usually seems like they have a flu, and within 1 to 7 days, they develop those symptoms in most cases. The early diagnosis and treatment are very, very important because the fatality rate is pretty high. It's 30 to 100%, depending on the patient. Here we outline two types of plague, although there are three, which we'll get into. So, plague is, as I mentioned, primarily transmitted by the bite of infected fleas. And the fleas bite a mammal that's infected. Then the flea bites us and transmits that bacteria to human beings. You can also contract plague by directly touching or somehow consuming tissues of infected mammals. It's generally rats and cats. Usually, this is fecal oral route. So, if you somehow ingest the feces of rats or cats, you may become exposed. It can also be done via blood and mucous membranes. The other method of transmission that's the most scary one, though, is the inhalation of respiratory droplets. So, patients who have the pneumonic form of plague um, shed those respiratory droplets, just like for COVID. And if you inhale them, then you might have an onset of symptoms of less than 24 hours. Bubonic plague, however, is not transmitted between humans, and it takes 2 to 7 days to incubate and start with the onset of symptoms. And there you can see we have a little meme in reference to people who refuse to wear face masks. Plague was so big in Europe that we still reference it like 600 years later. Here is a map of where the plague is transmitted across the globe. You can see we've got quite a bit of it here in the US, and we are included in that in Texas. The place I really want to point out here is Madagascar because they're the ones who have yearly outbreaks, and they had a pretty severe one in 2017 that we'll get into. This little pixelated illustration just shows which types of plague infect what. So, bubonic plague generally only impacts the lymphatic system. Septicemic plague is usually a progression from bubonic plague that also impacts our cardiovascular system. And pneumonic plague is your respiratory disease. And oftentimes it does impact those other two systems that are listed here. From this point on, I do have some gross images of gangrene and buboes, so if you're squeamish, turn back. So here are your clinical signs and symptoms of each of those types of plague that we just discussed. So there is generally a progression. If you get bit by an infected flea or you contact a mammal's tissues that's infected, you're probably going to get this bubonic form here. You can see in that little groin region is called a bubo. So that is a lymph node that is trying its darndest to contain the infection, and it can get very large and swollen and painful. The buboes are usually in your groin area, your axillary area, and your neck. From there, it can progress to septicemic plague, where you start to see gangrene, especially in the toes, fingers, and nose, and then pneumonic plague. So that's a radiograph image there of pneumonic plague. Air on an x ray shows up as black. And so you can see half of those lungs are pretty much completely blended in with the other tissue of the chest. That's pretty bad. That's a pretty extreme form of pneumonia there. And the type of infection depends on how you were infected, what your bacterial load is, and your own immune response. So we'll start with bubonic here, and I'm going to read this quote from the CDC. Most patients develop a sudden onset of fever, headache, chills, and weakness in one or more swollen, tender, and painful lymph nodes called buboes. This form of plague has a 30 to 60% fatality rate if it's not treated. So that's higher than you would like. Septicemic plague, it does broadly overlap with the symptoms that we just listed for bubonic plague, but you also see the skin on fingers, toes, and nose turning black and dying, as you can see in the image on the right here. There's also it appears to be bruising, but there is a phenomenon where your vessels become leakier and bleed into your skin and other organs. So you can have secondary issues in other organ systems because of this that I won't be discussing today. So septicemic plague can be secondary to bubonic plague, and it usually is. It's usually a progression of bubonic plague that occurs in some people, but it can also be your first symptom. Some people go to the doctor because, doc, my fingernails are black. What the heck? Up next, we've got pneumonic plague. This is the terrifying one. This is the one that you lose sleep over because it is 100% fatal without antibiotic treatment. You can see here on the bottom left, I've got that image from Monty Python, the Bring Out Your Dead skit. Um, Although that guy says he's not dead yet, he's going to be if he's got pneumonic plague, and they probably should be wearing face coverings. Anyhow, if usually if it is developed, it actually you see the septicemia first in most patients. That's because it's become a circulatory problem rather than just a lymphatic problem, and your lungs are seeded by the bacteria which causes the pneumonia. But in most cases, people who have pneumonic plague caught it from somebody else who have pneumonic plague, and it transmits the same way as COVID does by inhalation of respiratory droplets. So once again, we have that broad overlap of the bubonic and septicemic symptoms, but we've also got a shortness of breath, chest pain, cough, bloody mucus and or watery mucus, and our two big ones, respiratory failure and shock. Obviously, those last two generally lead to death. I thought that this image was really cool. At a glance, my coworker thought it was people in KKK robes, but in fact, this is historical PPE. On the Gibson Islands in 1900, they had an outbreak there, so this was the medical team of one of the hospitals that was responding to that outbreak. 57 people died that we know of, and it was pretty brutal, but obviously, we can see we've got some face masks there, so they were doing a really good job fighting it, and it was a well documented response to this outbreak. But we've got our historical outbreaks, which are less well documented because they happened in the 14th century. We know pretty well that Europe just was completely ravaged by the plague. They called it the Black Death, and you can see in this image it's just caskets upon caskets upon caskets. It's almost as many caskets as there are alive people here. It is one of the most feared diseases historically of all time, and it is believed that they ended massive outbreaks by quarantining asymptomatic symptoms or citizens, excuse me. So, same thing that we should be doing now. This artwork here comes from the 14th century. Here, I just wanted to include this because we still are aware of and joke about this plague outbreak, which, considering all of the historical diseases, it's funny that this one is so well known. But I did do some research into the rumor that the Ring Around the Rosie children's rhyme is based off of the bubonic plague. And it seems like most people who know what they're talking about don't support that at all. It's hard to say, lack of evidence means it's not true, but it does not seem to be true from what I heard. So I don't think that Ring Around the Rosie is actually based on the plague, but that is disputed. Here we've got a modern plague outbreak. As I mentioned earlier, Madagascar had a pretty rough one in 2017, to quote the World Health Organization. From August to late October 2017, more than 1,800 suspected, probable, or confirmed plague cases were reported, resulting in 127 deaths. So, considering that 100% fatality rate of pneumonic plague, 127 deaths out of 1,800 is pretty good. I mean, I think that they did pretty well in their response. And here you can see two WHO employees doing diagnostic testing during that outbreak. Madagascar does have a plague season. They have plague almost every single year, an outbreak, and it's usually from about August to late March. So it is a pretty long one, but this was a particularly bad year for it. Treatment. This is always my favorite part. So primarily is antibiotic therapy is going to be the number one tenet to treatment. Streptomycin, pictured on the right, is the most effective. Um, it's pretty much the go-to for plague, especially the pneumonic form, but all aminoglycosides are effective. So here I have gentamicin, picture, there was at least a half a dozen different antibiotics that are effective against Yersinia pestis. They're named for their amine modified glycoside, and what they do is inhibit protein synthesis in Yersinia pestis. Combined with the antibiotic therapy, we do offer supplemental oxygen, generally for our pneumonic patients, and IV fluids for everyone across the board, if there are those resources. Generally, with plague outbreaks, if I'm being honest, it is in third world countries, so this isn't always offered. But you never know where it could happen. Y'all saw the map. So patients with pneumonic plague are isolated so that they don't spread it. So they can be put in a negative pressure room. And what that does, there is a lower air pressure inside the room than there is outside the room. So every time you come in and out and open the door, air rushes in rather than rushing out so that those respiratory droplets can be under control and aren't spread throughout a hospital. Um, the patients and the healthcare practitioners should be wearing high efficiency particulate air masks. And of course, we like to isolate the patients. I think I put that there twice. It's important. There is a vaccine for Yersinia pestis, and this nice fella, whose name I'm about to botch, Valdemar Mordecai Hafkeen, developed it. It is considered, quote, the first effective prophylactic vaccination for a bacterial disease in man. It was researched in the late 1800s in Mumbai, India, where there was an outbreak going on. So there was lots of, plague to be studying. If you're brave enough to go to a plague outbreak and research it, that's pretty cool in my book. So after the vaccine was actually developed, they started, implementing it in India where there used to be really bad outbreaks. And in 1902, there was a bad batch of the vaccine. It was contaminated with its tetanus, and it actually killed 19 people in Punjab, India. So this fellow was pretty controversial back then, just because some people who were developing, who were making the vaccine that he developed had made mistakes. He was never really incarcerated or blamed, but the government did formally exonerate him in 1907 because his reputation was so bad. People just talked about how much they hated Hafkeen. And I could find 3 different nonprofits and for-profit corporations named out of him that were in Mumbai, India. Primarily the Hafkeen Institute, and there were a few drug companies as well. So his reputation has come back around. While there is a vaccination that's very effective, you can see its efficacy in rats here on the right. Those who are immunonaive get sick and die largely, and those who are inoculated with 1 oral dose of this virus all survives out of our 6 healthy rats that were given the disease. However, it's only recommended in extremely high risk groups because it's just not big enough of a concern to want to to want to widely vaccinate. So we're talking extremely high risk groups. That is lab personnel who are constantly exposed to the bacteria, And healthcare workers, where it's an endemic disease and outbreak is likely. So that's largely Madagascar, a couple of places in Asia and Africa. Um, Healthcare workers are not recommended to have this vaccination here in the US. And that's it. These are my sources. Thank you so much for watching.